All right, so let's talk about health and wellness. And oftentimes people are confused about are they the same? Are they different, etc. Spoiler alert, they're different. All right. They're different. They're different from one another, but they interact with one another, right? So just nice short, before we even get in, before we start talking about everything individually, we have to understand or what I like to say is health is the outcome and wellness is the journey. Health is what we are trying to achieve, and wellness is the how we are going to achieve those health outcomes. Some of the things to understand is that health is very subjective, right? And the wellness journey really depends on what the health goals are. Some people may have similar health goals, i.e., some people may be trying to get that perfect blood pressure of 120 over 80. And so that's the health outcome. Now, how people are going to achieve it are going to be different. Some people focus just on diet. Some people focus on exercise. Some people won't do anything at all, right? Some people just naturally will have it. So the health outcome and the wellness journey is very subjective to the people, and even people who have the same health outcome or health goal, their wellness journey is going to be individualized to them. And so when we think about health, it's a very subjective term. Everybody's going to define it differently. If I was to ask you all to share out to me, what is your definition of health? Each one of you will come up with a different definition of health. You can ask your patients or your clients what they are trying to achieve, and each one is going to have something unique, very similar in essence, but still unique to them, their situation, their lived experience, etc. But we do have some textbook definitions. And um, before I read the definition, we have to understand that back in the day when we used to talk about health, people used to think that health was you were in good health as long as you were free of disease, as long as you had no wounds, i.e., your bones are intact, you have no lesions, cuts, bruises, etc. As long as we can look at you and you looked healthy, then you were healthy, right? Your organs are intact, no internal things going on, you were healthy. But fast forward to today with modern science and technology, and also with the advancements of understanding people's lived experiences, we understand that not every health problem can be seen. If you think about what is one of the biggest health problems that can't be seen, and I know a lot of people are going to be like, oh, cancer or diabetes. And I hear you, but we could test for that, right? We can test for that. We could do blood tests, etc. We can look under microscopes, etc. But the one thing that we really can't see is mental health. Mental health, when we try to test for mental health, it's subjective. People take a survey, right? And then based on that survey, which they're the ones that answering the questions, you get diagnosed, right? But if you answer the questions perfectly, because you know what the assessment is, someone told you what the assessment is, and you answered it correctly, you can go ahead and fake that you don't have a mental health issue, or you can go ahead and fake that you do have a mental health issue, right? So those tests are very subjective at times. They're validated, and there are certain things in there to test to see if someone is faking or not. But understand mental health is one of those things that people cannot see, nor do people truly understand it at times either, because even though some people have the same diagnoses, not everyone arrives or gets it the same way. So, when we define health, health is a state of complete physical, mental, and social well being, not just the absence of disease and infirmity, right? So, it's not just absence of disease, it's not just an absence of sickness, right? It's more than that nowadays. We understand that health is this holistic thing. Health are the goals we want to achieve, right? Health is the outcome. Wellness is also something that not a lot of people understand. Many people have different definitions of what wellness is, but people have a general agreement, and this comes from the National Wellness Institute. And what they understand about wellness is considered a conscious, self-directed, and evolving process of achieving full potential. And wellness needs to be multidimensional, and holistic. And so when we say that, what we mean is that when you look at health, which we're going to learn how health, you can look at health as a pie, and then we take slices, which we call dimensions of health. And so when you're trying to achieve health, right, you want to try to um, get as many slices as possible. So when you're going to the gym and you're working on your physical health, you're not just working on your physical health, you're also working on your mental health. You might actually make some friends. So now you're working on your social health. You might become what is called a gym rat, or you might come part of this fitness culture. So now you're working on your cultural health, right? There's many aspects that we might be working on when we do something. And so the when you're trying to practice wellness, the goal is to try to hit as many of those dimensions of health as possible. So it needs to be multidimensional, it needs to be holistic. The whole self needs to be worked on when we're trying to achieve health through a wellness focused lens. And so wellness is a lifestyle, it's a mentality, right? It's who you are, and that's what we're trying to do. When we are trying to achieve health, we are doing these lifestyle shifts. And so when you think about wellness as a whole, it should be something that's positive and affirming. It's something that you want to do, right? People can't force you to be on a wellness journey. It's something that you need to decide to do on your own. And wellness is how we achieve health, right? So health is the outcome, wellness is the journey, wellness is how we are going to achieve that health. And wellness is not something that is passive, it is active, it is intentional, it's multidimensional, and also it's a holistic approach. You don't just sit back and achieve wellness. And so this is the wellness continuum. And one of the things to understand about the wellness continuum is that our health as a whole is dynamic, it's constantly changing. One day you're sick, one day you're not sick, one day you feel indifferent, right? One day you feel like you're on top of the world, right? Our health is not static, it's constantly shifting. And so the wellness continuum talks about the ever changing process that moves us between this illness to this optimal wellness or this optimal health. And so when we look at that, we need to understand that the goal is to move from that reactionary care to proactive care. So let's look at the continuum. And we see on the left side, we have poor health, the middle is neutral, and then the far right side is optimal state of well being or optimal state of health. And on the left side, when we are in poor health, that means that we don't feel well. When you don't feel well, where do you go to? The doctor. And so what that is we are reacting to symptoms. We are reacting to not feeling well. So we go to the doctor, right? And then when we don't feel well, I mean, then we feel starting to feel better, which most of us on an everyday basis feel decent. We feel good, not sick, not the best health. We just out here living our best lives, and that's the neutral state. And the neutral state, this is mostly where people who are 20 to 40 kind of live in. We're not, we're our health isn't bad. It could be better, but hey, we out here living, and so we tend not to go to the doctor as often. And so that's the neutral state. The goal of wellness, the true wellness journey begins when we push beyond the neutral state and we become proactive about achieving positive health outcomes, right? They say that our fitness level should be at this level. So you may try to go ahead and achieve that by going on more runs, more walks, etc. You know that if you don't use it, you lose it as you get older. So you begin to start using it a lot more, and that's more proactive, right? We want to be proactive and try to achieve positive or this optimal state of well-being. Um, and so when we think about, for example, when we think about intellectual health, which is a dimension of health, We the way to look at that is when you were a kid, when you were, in high school, you were forced to go to school. So you're reacting to the law. You had to be there by law. You had to go there. But once you graduate, you don't have to go to school anymore. That's the neutral state, right? You don't have to go to school anymore. But for some reason, you decide to enroll in college. And now you're pushing beyond the neutral state to the proactive state. You decide to enroll in college to push yourself to get a higher intellectual health. And you're trying to get optimal intellectual health. And so you're being proactive about your intellectual health. You're not just sitting in that neutral, right? So when high school, elementary, all that stuff, you were forced to be there. So you're reacting to people. I gotta be here. I gotta go to school. I don't want to go to school, but I have to go to school. Then when you graduate, you have the option to either just go to work or not even enroll in school. But for some reason, you decide to enroll in school. You decide to take your intellectual health into your own hands and you decide to be proactive about it. And therefore, you enrolled in college and now you're here. And so you are being proactive about your intellectual health and you are pushing beyond the neutral state and you're pushing on to that optimal state of intellectual health. So when we look at CHWs and the wellness continuum, the CHWs work across the entire continuum. They work through the reactionary phases, they work through the neutral phases, and they work through the proactive phases as well. So when we look at when someone's severely sick, right, they're in that reactionary phase or in that poor health phase. CHWs helps individuals manage the chronic conditions like diabetes, hypertension, asthma by providing education, referral, and self-care strategies. When we're looking at the illness and disabilities, they're assisting patients how to navigate the system, how to take medication, doing screenings and follow-ups, etc. And also that treatment and recovery. They're helping with the medical treatments by offering peer support, transportation, and connection to community resources. When people are in the neutral state, they're encouraging people to participate in preventive care like vaccinations, routine checkups, promote mental health awareness, and address social determinants of health. And then when we think about the proactive phase, right, really pushing beyond that neutral, so they're helping lead health and educational workshops on nutrition, physical activity, etc. They also might try to empower people to maintain optimal well-being through self-care, community engagement, and also long-term health planning as well. And another thing, let's go ahead and continue this, is that when we think about health and wellness, you think about, well, how do we know what are our health priorities, right? How do we know what are the health priorities and things that we can focus on? And to understand that, we need to understand the flow of data. Data flows from the local to the state to the national level. And then what the national at the sitting at the national level is what is called the Healthy People Program. And the Healthy People Program collects all the health data across the nation. And it looks at this data and it's like, these are the priorities that we should be focusing on a nation. Here are some evidence-based practices that people have utilized in order to prevent, in order to decrease these health problems that we are facing as a nation. Also, they may say like, hey, here's also some areas that we need a little bit more research on because it's a growing problem, but yet we don't have any solutions yet. So we need to go ahead and create some solutions. And so the Healthy People Program collects all that data and they provide evidence practices and they provide a snapshot of the health of the United States. And they've been doing this since 1980. And so every 10 years, they release these goals and these objectives that us as a nation should be working towards. And so, like right now, we're in Healthy People 2030. When 2030 comes up, we'll be in Healthy People 2040, and so forth. And it's very specific. It's looking at measurable goals, things that we actually could measure, things that we actually could try to achieve. And so, what it does is it helps the local people to look up and be like, okay, how do all these things relate to my people, right? Because all the objectives that the healthy people come up with is not going to relate to every single local area because it's a snapshot of the entire nation. But local people could be like, hey, or state level people could be like, hey, of all these things, which one are we most impacted by? Oh, look, we're most impacted by, I don't know, cardiovascular disease. Let's throw that out there because it's the number one killer, right? So, what has been done by other people across the nation to make changes? And then what have we tried? Oh, look, we tried this, it wasn't working. Well, they tried this one. How about we try this solution too over here to see if it works? Let's pilot, right? And so that's how the Healthy People program helped um, people to improve positive health. And so when you look at the Healthy People program, the key objectives are to improve health and well-being across all life stages, meaning from conception of a child all the way up until someone passes away. Reduce health disparities and health inequities, right? So health disparities, preventable differences, health inequities, the the disproportionate distribution of resources. Member health equity is providing resources based on need, and also promote social determinants of health as critical to health outcomes. It's social determinants of health is the understanding that we have not just personal influences that impact our health, but society, things within society that are also impacting our health, aka they're determining our health. And we also use data-driven strategies to measure progress and inform policy. And so when we think about the impact, it guides public health planning and funding because essentially, I know a lot of politics are coming to play when it comes to funding sources for public health, but ideally, the government should be funding programs based on evidence. And so the Healthy People program collects the evidence and is like, hey, these are the issues that should be funded. And so which areas are most impacted by these issues? Those are the areas that should be getting the most resources, aka equitable resources, providing resources based on need. Also informs healthcare professionals, educators, and policymakers about national health priorities. Encourage cross-sector collaboration. Right, we can't work in silo. We need to work together to provide solutions. And so, in essence, CHWs can be the healthy people champions, right? CHWs are essential in translating healthy people objectives into real world impact. Really looking at the Healthy People program and finding, okay, what are the major problems? And then is my community, my special population, is it impacted by this? Oh, yes, it is. What did they do at the national level or discover at the national level that potentially I utilize here within my special population to improve them? Their work directly supports health equity, disease prevention, and community wellness. And also by addressing social determinants of health, CHWs help bridge gaps in care and improve national health outcomes.